Hi, my name is Mallory Bayo, and today we're going to talk about skin fold measurements, specifically a 3-site skin fold measurement opposed to 7. So today we're going to talk about the 3 points of the tricep, the subscapular, and the suprailiac. First off, what is a skin fold measurement? A skin fold measurement is a more direct way to assess body fat percentage with the use of a caliper and the pinching of the skin. Today, we don't have a caliper, so I'm just going to explain it quickly. A caliper is a tool that you can hold in one hand, and it measures the distance between one object by 2 decimal places, and I believe it is the unit measurement of millimeters. And before we get into how and where we're going to be doing these measurements, I just want to talk quickly about a few guidelines that we need to follow when we are taking these measurements. So first, all measurements should be made on the right side of the body. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. Your pinch should be maintained the entire time while you're taking the reading. You want to hold this for 2 seconds to make sure that you're getting the most accurate count. We want to take 2 of each reading just to make sure that we have an accurate reading on the measurements between your skin fold. One thing to note is when we are taking these measurements, you want to make sure that you do all 3 or all 7 sites and then go back, because we want to make sure that the skin, and give the skin some time to regain its shape and go back to normal. And lastly, if your subject is wearing clothing, you want to account for that in our readings. So you would really just hold the clothes and take a reading there. So if it's, a reading of 1 or, a half, then you would subtract that from your reading, and you would later put that into your equations. So our first site that we want to go over is the tricep site. This site is a vertical fold on the posterior midline of the upper arm, halfway between the shoulder and the elbow. For the tricep region, again, you're going to have the subject standing with their arm below. You want to use the middle point of the tricep, so you would be in the back. The tricep is here. I don't have a demonstration, so we're going to talk it out. So as the measurement person, I'm going to take my pinkies, placing 1 pinky on the shoulder, 1 pinky on the elbow. Then I'm going to turn my thumbs in, and that'll be the midpoint. Once I get that midpoint, I'm going to take my hands and I'm going to have my left hand and grab the skin. If the subject is very muscular and you cannot tell the difference between the muscle, the adipose tissue, and the skin, you're just going to ask them to flex their muscle. Once you can directly tell the difference, you will ask them to relax their arm. Then you will hold the skin together, and you'll take your caliper in your right hand, and you will hold for 2 seconds. Then you'll take your measurement, and then we'll move on to the next, which is the subscapular region. The subscapular region is a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. And you want to make sure the subject keeps their arm freely at their side. So you would have them standing this way with their arm free here. I don't have a subject, so I'm going to quickly show you where the scapula is on a person. This is the red highlighted. In this skeleton, the subject would be facing the wall, and the red part is the scapula. So when we're taking our reading, we want right below here. If the subject is very lean and we cannot tell the difference between the muscle, the adipose tissue, and the skin, we would ask the subject to place their arm behind their back, like so, and you will be able to tell where their scapula is. Then you would have them put it back to the side, and you'll be able to, with your left hand, pinch their skin. With the right hand, you'll always be holding the caliper. This point, you will pinch the skin and hold with the caliper for 2 seconds to get your reading. And then we'll move on to the next point. The third and final area that we're going to be measuring is the suprailiac. The suprailiac region would be a diagonal fold in line with the natural angle of the iliac crest, taken at the anterior axillary line immediately superior to the iliac crest. So I'm going to stand up very quickly. When we talk about the axillary line, we talk about from our armpit down. So we look straight down. And the iliac crest is the most upper part of your hip bone. Again, I don't have a subject, so I'm going to show you a visual. Okay. In red is where the iliac crest is, right above the hip bone. So again, this would be the right side of the body. And when we take this measurement, some subjects are sensitive, or maybe I will have a opposite gender that I will be taking the measurement on. So, or same gender, whomever your subject is, you always make sure to ask them to touch their iliac crest so that they know where you're touching, and they are okay and with you touching that part of their body. Next, you will take your thumb, not your 2 fingers, and touch the iliac crest and feel for the skin. Once you are ready, you will take your index finger and you will pinch the skin. In your right hand, you will have the caliper. You will hold on the measurement 2 seconds and count your measurement and record it on the paper. Now that you have all 3 done, you would wait a few minutes. Ask the subject if they're comfortable, they feel as if they're ready, and you'll take them again just to double check your measurements. And again, the standard error here is about 3.9% body fat. So when you do put this into the body density formula and you get your percentage, you then have to also account for human error of 3.9% body fat. I hope this is helpful. Thank you.